Hi, my name is Bettina Neumann and I'm physical therapist at Rising Sun Physical Therapy. April is a National Foot Health Awareness Month. And for that, we want to invite you to explore your feet a little bit more. And we're going to give you weekly exercises to help you to get ready for those amazing hikes and being more outdoors. We're trading in our shoes, our big shoes, our boots possibly, to lighter shoes like even sandals, or maybe we're even going barefoot at some point. So our feet are oftentimes stuck in those shoes and they don't have so much movement. So what I want to invite you today is that you're going to take off your shoes, you're going to take off your socks, and just go ahead and sit down. I'm hoping that you can see my feet here, and sit down on in a comfortable position. Yeah, so either on the floor or on the chair, wherever you are. So just take off your shoes, take off your socks, and let's do some exploration of your feet. So let's talk first a little bit about the joints of the foot. So we have the ankle joint, which is connecting the shin bone with the ankle. And in that joint, we have the flexion and extension. So it goes up and down. So we can do this more like just use your hand to help you with this movement, yeah? And then the next joint, subtalar joint, it goes in and it goes out, yeah? And in and out. So also call this supination and pronation of the foot. So this is supination, this is pronation of the foot. And you might feel that when you do it more actively, where you feel the muscles move and work in your lower leg, yeah? And it goes in, and it even acts on my knee here when I'm coming in. It creates a different position in my knee than when I'm going out, yeah? So just pay attention to those details. So then we are going to come to the transverse joint, and that joint is more like a rotational movement in the foot. Oftentimes it's very stiff in that area, so it kind of like has a twisting movement, like wringing out a towel or something like that. So rotating that foot in and out. Yeah, if you can do that, that would be great. And then do this more actively. So when you feel that you're holding just above the bone here on where you're standing on and then you're moving in and out. And then you have those joints which are connecting to the toes. They are more like flexing and extending and flexing again, yeah? Extending and flexing. You can even put your fingers in between your toes. That really feels good. A lot of you might feel like, ooh, that feels really odd because you haven't really done this. And then move your foot down and up. But if you do this for a few days, it will feel a lot easier to do, yeah? You can also do it with the other hand from the top, just moving it up and moving it down, yeah? So just help your foot, your joints in your foot to move better. And then you rotate that whole foot, so all the different joints in that foot are connecting and moving in coordination with each other. So twisting in one direction and then in the other direction. Now we're going to stand up and just feel how you're standing on that foot you just worked on. And how is it standing on the other foot? I feel like I have a lot more connection with my right leg right now. I worked on my right foot with my right leg into the floor. Yeah, I feel much heavier here. I feel like I'm connecting my foot. It has more sensitivity and awareness in on the floor. Yeah, and then you just go ahead and from this point just start moving slowly over the floor. Feel that heel coming down, and feel how that whole body is moving onto the floor with each step. Yeah, just do a few steps. And then come to a pause. Close your eyes, put one hand on your chest, one hand below your belly button. Feel where you are connected to the floor on the right side, the left side. Swing a little bit to the right, swing a little bit to the left. Where do you feel that connection on the foot? Then you come back and come forward and back and forward. Feel how your weight is coming more onto your forefoot, and then your weight is coming more onto your heel. How that connects with your spine, with your hip, with your pelvis, and even all the way up to your head. How that is changing your position. And then find a position where you're kind of like having that's centering your foot, so you're not on your heel and not on your forefoot, but somewhere in the middle. And that is your bubbly well. That's kind of like in this position here of your foot. So feel that center. And how is this relating to your knees, to your hips, to your spine, to your head? Take a deep breath in and then shake it all out. So I want to invite you to take a few moments every day and just pay attention to those feet. Play with your feet like you're a baby. Like when you were 4 to 8 months old, you were playing with your feet all the time. When you were lying on your back, your feet were constantly in your hands and even in your mouth. Yeah. So play with your feet. Go back to that place where you explore your feet more. And then walk with more awareness and with more consciousness. Thank you very much, and I hope you have a great week.